What if you could predict a health crisis before it strikes? Picture the future of healthcare technology, a realm where the impossible becomes possible. We're talking about a revolution, a seismic shift that could change the face of healthcare as we know it. Think about the power of technology, not only to heal, but also to predict, to prevent, and to manage health crises. Imagine a world where technology can help us predict, prevent, and manage health crises, all at the touch of a button. Consider the rise of telemedicine, a product of digitization. This innovation has ushered in a new era in healthcare, transforming the way we access and deliver medical services. Let's delve a little deeper into this fascinating case study of progress. Telemedicine at its core is the use of technology to provide healthcare remotely. It's a simple concept, but its implications are profound. It's not just about video consultations with doctors, although that is a significant part of it. It's also about remote monitoring of patients, digital transmission of medical data, and even robotic surgery performed from afar. One of the most significant advantages of telemedicine is that it increases access to health services. For individuals in remote or underserved areas, getting to a doctor's office can be a challenge. Telemedicine bridges this geographical gap, bringing healthcare directly to those who need it, right in the comfort of their homes. But it's not just about geography. Telemedicine also enhances access for individuals with mobility issues, those with chronic conditions requiring frequent checkups, or even those who simply can't take time off work for a doctor's appointment. By breaking down traditional barriers to healthcare, telemedicine democratizes access to medical services. Beyond access, telemedicine also offers the potential for improved quality of care. By allowing for continuous monitoring and real-time communication, it can lead to earlier diagnosis and intervention, potentially saving lives. And let's not forget the cost savings. Telemedicine can reduce healthcare costs by minimizing hospital visits, cutting down on travel time, and allowing for more efficient use of healthcare resources. There's also the environmental angle. By reducing the need for travel, telemedicine can help cut down on carbon emissions, aligning healthcare with our global sustainability goals. But it's not just about the practical benefits. Telemedicine also represents a shift in how we perceive healthcare, from a service that requires us to go somewhere and wait, to one that is available on demand whenever and wherever we need it. Telemedicine, a once distant idea, now forms an integral part of our healthcare system, thanks to digitization. It's a shining example of how technology can drive progress, improve lives, and transform industries. And the best part? This is just the beginning. Artificial intelligence isn't just for sci-fi movies anymore. It's here, and it's transforming the world of healthcare as we know it. One of the most promising applications of AI lies in diagnostics. Diagnosing diseases is often a complex process, requiring a deep understanding of symptoms, medical history, and clinical tests. AI can assist in this process, making it faster, more efficient, and more accurate. Let's look at a real-world case to get a clearer picture. Consider the detection of skin cancer, a disease that, if caught early, has a high survival rate. Traditionally, the diagnosis of skin cancer involves visual inspection by a dermatologist, a biopsy, and a waiting period for lab results. This process can be stressful and time-consuming for patients. It's here that AI steps in. Researchers have developed AI algorithms that can analyze images of skin lesions and predict whether they're likely to be cancerous. These algorithms are trained on thousands, sometimes millions of images, learning to distinguish between benign and malignant lesions. In some studies, these algorithms have shown to match or even outperform human doctors in accurately diagnosing skin cancer. Imagine the potential impact of this technology. It could be used in telemedicine applications, allowing individuals in remote areas to receive accurate diagnoses without needing to travel. It could speed up the diagnostic process, getting patients started on treatment plans more quickly, and it could potentially reduce healthcare costs by cutting down on unnecessary biopsies and tests. But it's not just skin cancer. Artificial intelligence is being used to assist in the diagnosis of a range of conditions, from heart disease to diabetes to mental health disorders. The possibilities are truly staggering. Of course, AI isn't a magic bullet, it's a tool to be used in conjunction with the expertise of healthcare professionals. But it's a powerful tool, one that holds the promise of transforming the diagnostic process. AI has the potential to revolutionize diagnostics, making it faster and more accurate. The future of healthcare technology isn't some distant reality. It's happening right now, and it's incredibly exciting. Wearable technology is no longer limited to fitness tracking. This statement rings true today more than ever. The emergence and widespread adoption of wearable health technology have been nothing short of phenomenal, transforming the way we monitor our health and well-being. Let's delve into a real-world case study that illustrates this shift: the Apple Watch's electrocardiogram, or ECG feature. This nifty little device that straps on your wrist is much more than a timepiece. It's a brilliant example of how technology has been miniaturized and optimized to perform tasks that were once confined to specialized medical equipment. The ECG feature of the Apple Watch has been a game-changer in heart health monitoring. It allows users to take an ECG similar to a single-lead electrocardiogram. So how does it work? Essentially, it's a test that records the timing and strength of the electrical signals that make the heart beat. By checking these signals, the ECG feature can get information about different aspects of your heart's health. But it doesn't stop there. The Apple Watch continuously monitors your heart rate and rhythm, alerting you if it detects something unusual. This feature has been instrumental in detecting undiagnosed heart conditions in many users, who were then able to seek timely medical intervention. What's truly remarkable about this is the preventive aspect. It's not just about diagnosing or treating a condition, but about preventing it from escalating. Wearable technology has given us the power to monitor our health in real time, to be aware of our bodies, and to take action when necessary. It's like having a personal health consultant right on your wrist. The impact of wearable technology extends beyond individual users. It has significant implications for the healthcare industry at large. It allows for more comprehensive patient monitoring, improved data collection and analysis, and ultimately more personalized and efficient care. In conclusion, wearable technology has evolved from being a novelty item to being a vital tool in health monitoring and preventive care. It is an exciting testament to the power of technology and its potential to transform healthcare as we know it. Wearable technology, once a novelty, is now a vital tool in health monitoring and preventive care. However, digitizing health isn't without its challenges. As we move further into the digital age, we encounter new obstacles that require our attention. Let's explore some of these issues together. First and foremost, data privacy is a significant concern. With the digitization of health records and personal information, there is an increased risk of data breaches. These breaches could lead to unauthorized access to sensitive information, potentially resulting in identity theft or other forms of cybercrime. The healthcare industry must therefore prioritize robust data protection measures to safeguard patients' privacy. Next, we have the issue of the digital divide. Not everyone has equal access to digital resources. This inequality can be due to numerous factors including socioeconomic status, geographic location, age, and disability. This digital divide can lead to a disparity in the quality of healthcare received. For instance, those without reliable internet access may not be able to benefit from telemedicine services or online health resources. There's also the challenge of ensuring that artificial intelligence and machine learning systems are unbiased. These systems are trained using data, and if that data is biased in any way, the system itself could propagate those biases. For example, if a diagnostic tool is trained mostly on data from one demographic, it may not perform as well for other demographics. Therefore, it's critical to use diverse and representative data when training these systems. Finally, we must consider the ethical implications of wearable technology. While these devices can provide valuable health insights, they also raise questions about privacy and consent. For instance, should employers have access to the health data collected by a wearable device provided to their employees? While the potential benefits are immense, it's crucial to address these challenges to ensure that the technology is accessible and beneficial to all. As we forge ahead in the digital health revolution, we must do so with caution, care, and a commitment to inclusivity and equity. The future of healthcare technology is not a distant reality, but a present possibility. We've journeyed together, exploring the transformative potential of digitizing health, from the convenience of telemedicine, which brings medical consultation right to our doorsteps, making healthcare more accessible than ever, to the precision of artificial intelligence in diagnostics, minimizing human error and speeding up the process of diagnosis. We've seen the power of wearable technology, turning passive patients into proactive participants in their own health management. These devices give us real-time insights into our health, enabling early intervention and preventive care. Yet we also acknowledge the challenges and ethical considerations that come with this digital revolution. We grappled with questions of data privacy, the digital divide, and the need for responsible use of AI. It's clear that while the technology is here, it requires careful implementation and thoughtful regulation to ensure it benefits everyone. But let's not lose sight of the bigger picture. The digitization of health is more than just the adoption of technology. It's a paradigm shift in how we approach healthcare. It's about empowering individuals, improving outcomes, and making healthcare more efficient and effective. As we continue to embrace and innovate, the future of healthcare technology holds a promise of a healthier world for us all. The future is now. Let's seize it, optimize it, and use it to create a world where health is a right, not a privilege.